Hello and a very warm welcome to you all. I am Vikas Nangia with Focus Live Season 3. Ladies and gentlemen, it's time for us to bid goodbye to the year 2020. We're all excited about welcoming the year 2021, but at the same time, there's tremendous stress, anxiety, depression as well amongst many of us because a disease which made our life very, very challenging in the year 2020 goes with us, moves forward with us in the year 2021 as well. Tonight, with our special eminent guests on the program, we talk about all the stress, all the anxiety, the present scenario of COVID-19. We will talk about the treatment part of of COVID-19. We will talk about the chemistry part about the vaccination, and more importantly, we'll also talk about the drug delivery, how it is reaching out to the destinations where it is being given to the frontliners who are right now front in the line. My three eminent guests on the program. My first guest is Dr. Sandeepa Utpat. She is the Chief of Infectious Diseases at Monmouth Medical Center, Southern Campus, affiliated with Robert Wood Johnson Barnabas Health System. My second guest on the program is Dr. Basant Sharma. Dr. Basant Sharma is the former global head Research and Development Division at Johnson & Johnson. My third and yet another important guest on the program is Dr. Navneet Shah. Dr. Shah is the President and Chief Scientific Officer at Kashiv Specialty Products. He's a distinguished scientist, and prior to Kashiv Products, he was the head of formulation at Hoffman Roche. All of you, thank you so very much for joining us on Focus Live Season 3. I'd like to begin my conversation with Dr. Sandeepa Utpat. Dr. Utpat, give us the sense of present scenario. We've been battling with COVID-19 for almost a year now. What's the treatment like that you are giving to the patients when the patients walk in the present scenario in the hospital with COVID-19?
Well, first of all, thank you for having me on your show, Vikas. So I have seen COVID-19 since the beginning of the pandemic. In fact, when it was in the news and we did not have the tests and it was nowhere close to our area, we were already looking for it actively. So as compared to that time, which was like probably February, March time frame, and now we've made a lot of progress as far as the diagnosis is concerned. So we don't nearly miss the diagnosis as much. And we have better modalities of treatment now, although nothing is perfect and there is no exact specific treatment. But we do have many more things at hand and less guesswork. But that's the good part. The other part, which still remains unpredictable, is the outcome. When a patient walks into the hospital, most of the time now the awareness in the public is so much that they are suspecting it even themselves, or they have gotten tested outside and they've been monitoring themselves. So what makes them come to the hospital is because they've been monitoring themselves and they notice all those changes. Now they know that it's beyond their own capacity to wait and watch. So that's when they come to us. Now, when they come to us, we categorize them practically based on the first vital signs that we get out of them. If they're febrile, automatically it puts them in a category of somewhat a moderate risk. If their oxygen status is less than 92% on room air, automatically they are in the moderate risk category. And if they have certain comorbidities additionally, like a lung disease or a heart disease or a diabetes or obesity, then the risk factor actually goes up by multiple points.
Yeah.
It's like a quantum leap. So that's where we are. The question that you were asking is about how are you able to treat it now as opposed to then? Like the answer is that. Because now there are some protocols that we follow, so we expect that they do better than hit or miss that was happening way back in March and April.
तो और आपको बधाई भी देना चाहूंगा कि आप लोगों ने वैक्सीनेशन रोल आउट हुई तो you were the front in the line to get those vaccinations. So that's quite trend setting as such. एक उम्मीद बन जाती है, when the doctors set the example. और ये उम्मीद से जुड़ा सवाल मैं आपसे पूछ लेता हूँ, फिर मैं डॉक्टर बसंत शर्मा एंड डॉक्टर नवनीत शाह की ओर बढ़ूंगा। आपसे ये जान लेना चाहता हूँ कि what really motivated you to get this vaccination? Was there any kind of pressure, or you wanted to set an example? You voluntarily did it? Because I'm also interacting with a lot of other doctors and nurses. Some still have a lot of apprehension to take this vaccination. Talk about that part, please.
Yes. So that's, you touched a subject which is very close to my heart. एक तो pressure, no pressure. I was the first one to volunteer, in fact request. I am on the medical executive committee of Mohammed Medical Center Southern Campus. तो पहला इंफॉर्मेशन हम ही को आता है मीटिंग में कि इतना वैक्सीन आने वाला है, अब आने वाला है, हम इस तरह डिस्ट्रीब्यूट करने वाले हैं, इस तरह रजिस्ट्रेशन होने वाला है. ऑल दैट टास्क फोर्स जो होता है, उस टास्क फोर्स में हम बहुत बड़ा रोल प्ले करते हैं. तो उसी टाइम में हमने मीटिंग में सीईओ, सीओ, सीएफओ सभी होता है. तो उसी टाइम में हमने पूछ लिया था कि क्या हम सबसे पहला वैक्सीन ले सकते हैं. यू नो, so they were stunned that I was volunteering because I had so much confidence in the vaccine. एक तो ये है. प्रेशर तो एब्सोल्युटली जीरो प्रेशर है. आज भी वैक्सीनेशन जो है मैंडेटरी तो है नहीं. वो बोल रहे कि एनकरेज कर रहे कि आप उसके बारे में थोड़ा जानकारी हासिल कर लो और बाकी जिन्होंने वैक्सीन लिया है उनकी तरफ देखो और फिर अपन वैक्सीनेशन करवा लो, क्योंकि जब तक मेजॉरिटी ऑफ लोग वैक्सीनेशन नहीं करवाएंगे तब तक ये तो कंट्रोल में आएगा नहीं. सो दैट वाज वन थिंग. और द मेन रीजन विकास दैट I thought about this disease throughout these 9 months. This is what I've been doing, eating, drinking, sleeping, right? तो ये मैंने चीज सीख ली कि डायग्नोसिस हम 100% कर सकते हैं आजकल. कोई उसमें कोई प्रॉब्लम ही नहीं है. और जो ट्रीटमेंट हमारे पास जो अवेलेबल है, चलो स्टीरॉइड हो गया, ब्लड थिनर हो गया, रेमडेसिविर हो गया, वो हम कॉन्फिडेंटली सबके ऊपर यूज कर देते हैं. तो व्हाट इज द वेरिएबल? जब सब वेरिएबल्स कांस्टेंट है तो विच वन इज द वन दैट इज नॉट इन कंट्रोल? दैट इज द वन कि हम आउटकम नहीं प्रेडिक्ट कर सकते हैं. कई बार 4 लोग अंदर आ जाते हैं हॉस्पिटल में, 4 लोग मैंने एक ही दिन में 4 लोगों को देखा उसी एज ग्रुप में, उसी कोमॉर्बिडिटीज में. पता नहीं क्यों कि एक बंदा अच्छा करता है, एक बंदा बहुत लेट हो जाता है, एक बंदा घर ही नहीं जाता है. तो ये अनप्रिडिक्टेबिलिटी है. कोई भी प्रिडिक्ट नहीं कर सकता इस बात को
जी.
सो दैट वाज वन थिंग. तो हमने सोचा कि देयर आर ओनली 2 ways टू गेट इम्यूनिटी. Either you get a natural infection and you are guaranteed some kind of immunity, you will mount some antibodies and you'll get immune. And the other way of getting immunity is vaccination.
Gee.
Now, what is the difference then? If you get naturally infected, I cannot predict your outcome. Whether you'll get a little mild disease and just walk away, or you will get a real severe illness and you'll never walk away from the hospital. वो है. And then when you get naturally infected, I do not know how much virus you're capable of spreading. तो कितना स्प्रेड करते हो, कितने दूसरों को कितना अफेक्ट करते हो, ये हम नहीं बता सकते. आपको शायद माइल्ड होगा, अगर आपने किसी और को दे दिया बहुत सीवियर हो जाता है. सो वैक्सीनेशन से ये होता है कि मेरे को इतना गारंटी है वैक्सीनेशन से कि पक्का थोड़ा सा अगर आपको बाजू में दर्द हो गया, थोड़ा इल हो गए, तो प्रिडिक्टेबल होता है उसका टाइमिंग भी और उसका सिवियरिटी भी. अब एक ही दिन के लिए, 2 दिन के लिए थोड़े से आपको एकीनेस लगेगा, लेकिन गारंटी आपको प्रोटेक्शन हो जाएगा कितना टाइटर में. और अभी जितना डेटा डॉक्टर फाउची बता रहे थे जामा की यूट्यूब के चैनल पे भी कि अभी तो डेटा रिलीज नहीं किया है, वो गैदर कर रहे हैं, लेकिन वो जो स्प्रेड जो होता है वायरस का, वैक्सीनेटेड इंडिविजुअल्स कम स्प्रेड करेंगे, ऐसी उम्मीद है. तो उसके लिए भी जब भी आप लॉजिकली सोचो और ये मैथमेटिक आप कर लो, तो नेचुरली इन्फेक्ट होके चांस लेने से अच्छा है कि आप वैक्सीनेशन लो. थोड़ा सा अगर इल हो जाए तो भी चलेगा, बट यू विल नॉट इन्फेक्ट अदर्स एट दैट लेवल and you will have protective antibodies a robust amount which you know that you will be protected for the next at least 6 months and hopefully more.
Yeah.
So that was my decision making factor in there.
And that's a great inspiration right over there. You know what really helped you or motivated you to make your decision to take this vaccination, and I'm sure you took the Pfizer vaccination. Dr. Sharma, I want to reach out to you. How much do you agree with Dr. Utpat? You know, whatever helped her to take the decision in taking the vaccination. Specifically, when she said, as per Dr. Fauci as well, that if if you take the vaccination, you are not only keeping yourself safe, but people around you safe as well. Speaking particularly from the chemistry point of view, the making of vaccination, how much do you agree with that?
I fully agree. So there are 2 points I like to raise. So सबसे पहली बात ये है कि जब से and help me Sandeepa ji, जब से protocol defined in a hospital, the recovery rate is better.
Yes.
You agree? Yeah. And what we need to do, we need to keep moving forward. So जैसे आपने कहा कि 4 बंदे आते हैं, I don't know which banda is gonna stay here and which banda is gonna go home. We need a more predictability. In order to get the more predictability, from the science perspective, vaccine is the solution. Whether you Pfizer ka ho, Moderna ho, AstraZeneca ho, Johnson Johnson ho, सब vaccination, because जैसे अभी बताया कि vaccination is going to help to raise the immunity. Whatever the percentage, even 30%, even 50%, even 90%, but it's going to help you, it's going to help your family members, it's going to help your friends not to spread the disease. So I fully agree.
Let me reach out to Dr. Navneet Shah. Dr. Shah, I want to ask you, delivery system in getting these vaccinations to the destinations where they're supposed to be is something very, very pivotal, something very important, specifically with the Pfizer, vaccination when they're talking about maintaining a certain temperature. In simpler words, for our community, can you make them understand that, the delivery process, that's one. And Dr. Sandeepa Utpad, I also wanted to ask you, as the vaccinations have rolled out, when it reaches out to the normal public, it could happen that they have 4 choices in front of them. They might have a choice of taking Pfizer, Moderna, AstraZeneca, or Johnson and Johnson. And each one of them have a different formulation, different process of delivery system, which one they should be going in for. Because some have double dosage requirement, some have one dosage requirement. So I'll get your reaction, Dr. Utpat, on that, and as a matter of fact, reaction from Dr. Sharma as well on that particular question. But let me first get to Dr. Shah on the drug delivery process over here.
So, as a drug delivery part, we all know probably, but I want to re-emphasize there are 3 major issues when we consider in developing the drug delivery or formulation. One is the safety, one is efficacy, and one is also the manufacturability. So I will take one thing at a time. Now, we are working on, right now, the 2 vaccines that we have been approved. The building block is mRNA. Now, if you take that building block of mRNA as such, it is very, very unstable. So the company has to modify a little bit in order to make more stable. But after doing that, still, as you know very well, the Pfizer vaccine has to be stored at minus 70 degrees, and Moderna vaccine has to be stored at a freezer temperature of minus 20 degrees.
Yeah.
Still, there is a temperature control is necessary. And one will ask the question, why? So what is happening is, after having the heroic efforts by the scientists of Pfizer and Moderna, modifying the mRNA, that was not enough. So they had to add the adjuvants, which can further not only improve the immunity part, but also the stability. There are other components, we call it stabilizer in pharmaceutical world. So we have to add the stabilizer, we have to add the preservative to maintain the sterility during the shelf life. And after all doing so, they have to use the special formulation component, what we call it, it's a lipid nanoparticles. So they are encapsulating the vaccine into the lipid particles, thereby further improving the stability. Despite the fact that after all these efforts, they still have to store at minus 70 or minus 20 degrees. So what is happening is Pfizer or Moderna, they may have done very systematic study in terms of temperature effect. So they may have started with the coldest temperature, -70, then -20, then refrigeration and room temperature. And based on the stability data, they have come up with the recommendation that this particular vaccine has to be stored either at -70 degree and -20 degree. I'm very sure Pfizer scientists are still working right now on improving the stability part or the storage part to bring it to at least -20 degree. So the distribution aspect will be much more easier. So we look for the definitely future. I think scientists are really addressing this issue very well. At least we have these two vaccines in front of us. And I think if you look at the number of vaccines available by the end of December or January, close to 100 million, I think it is remarkable success what we have in a very shortest time that we have. That's about the formulation part of the vaccine. With respect to what you asked, that what is this difference? Which one is better or which one is not better? To me, I think Dr. Sharma has very clearly mentioned that all this vaccine has gone through a very stringent safety aspects. For example, they go through the preclinical study, what we call it, that is animal studies. Then we do the phase 1 study in limited number of the subjects. Then we do phase 2 study in, again, very small population to just see the safety and efficacy. And after having a couple of months data, they went to phase 3 study in July. And now we have almost close to 6 months data about the safety. So I wanted to really emphasize to the public who is watching this show that after giving each organization about 50,000 subjects, and some people who I really like to salute them, they volunteered for this vaccine safety aspect and administration aspect. And now, as of today, they may have given to 2-3 million people this vaccine, either from Moderna or from Pfizer. So now the safety aspect for people like you and me, we are standing in a line. I think we have 3 million people already administered these vaccines. So I have no doubt about the safety, and I would definitely encourage that one should not think twice. And Dr. Sandeepa have mentioned very clearly that she will take it without one thinking about it. So I really agree with her statement that there is no safety issue. So you can take either one and it will be okay. One thing I want to appeal to the public is that don't think twice. I think if I want to relate to any drug development process, after working for almost 50 years in industry and R&D, when we develop any new drug, we do very limited studies, like 1,000 subjects or 2,000 subjects. Now, if you consider this vaccine, now it is already been tested in millions of people and administered. So don't think twice about taking it. I will be the first person to take it as well.
Yeah. On that positive note, I'm going to take a quick short break over here. I'm Doug Hirsch. You may already know that GoodRx can help you save up to 80% on your prescriptions. Unfortunately, many Americans can't get to a doctor right now. The good news is that for many health issues, you can see a doctor online. It's easy. Just go to GoodRx.com, and with a few clicks, you'll be treated by a licensed medical professional, all from the comfort of your own home. Visits are confidential and affordable. Need a prescription? Your doctor can send it to your pharmacy or have it mailed to you. Get the healthcare you deserve at GoodRx.com.
At touchofmodern.com, we get that the things you surround yourself with reflect who you are. Your style, your drive, your passions. Venture through a curated collection of astonishing items at touchofmodern.com, because sometimes things aren't just things, they're you. Go to touchofmodern.com and discover the world's most unexpected items. Right now, the world has never seemed more uncertain. The COVID-19 pandemic has plunged us all into uncharted territory, challenging our health, our livelihoods, our economies, and changing the way we live.
We've steered our customers through some of the toughest times in history, and we are well positioned to do so again.
For anyone preparing for their financial future, it's important to choose a partner that's successfully weathered what's come before. New York Life has been successfully navigating the unexpected for 175 years.
Some companies change to stay relevant. We're relevant because we've kept our promises for 175 years.
Once again, welcome to all three of you. Thank you so very much. Dr. Utpal, I'd like to reach out to you first, getting your reaction. What's the vaccination rollout plan? And B, when the four options would be available right now, even if one has to go and take the vaccination between the two, what's more preferred and why?
Okay, I will answer the first question first. So every hospital, forget about the hospital, every state was allocated based on their need. And out of that, every hospital has been allocated a certain number of doses. I'm going to talk about the hospital system first. So now when we got X number of doses, we had to make sure that we have enough doses to do two vaccinations, because that's how it was told to us that when you get, I'm just quoting a number, when you get 1,000 doses, you can vaccinate only 500 people. You cannot book 700 or 750 people because you need to ensure that that person is vaccinated on time again on day number 21, which is what happens in Pfizer vaccine.
So dose 1 and dose 2, they're just the same. It's just the same quantity. It's just that after a gap of certain time, you have to take the second dosage, right?
Exactly.
Okay.
So that there is no interruption because of a supply chain issue. We wanted to make sure that that person is completely vaccinated and not halfway vaccinated. There should not be a delay or an interruption. So that is why whatever doses the hospital got, only half of them were considered to get vaccinated in the first phase. There are certain terms sometimes are used. Some of them are used freely, and sometimes there is a little touch of bias to it. So I do not know which is the right term to use, but popularly it's called tier 1, tier 2, tier 3, or phase 1, phase 2, phase 3. I think in some places they prefer the term phasing because the tier is not used commonly, especially I was listening to the Massachusetts program yesterday, how they are dispensing their vaccine. So let us say, I'm going to use the term tier. In tier 1, they have identified the front of the frontliners, like you call. These are the people who are actually receiving the patients, are in the face of the patients who are known to be COVID positive or highly suspected to be COVID positive. That will be the emergency room physicians, nurses, infectious disease physicians, pulmonary respiratory therapists, and likewise. Then there will be the second tier where there is a question of whether they may or may not be COVID positive. So, and the contact is not the first contact. So that will be the tier 2. And then the tier 3 they work in the hospital, but they are not face to face with the patients. They could be in administration, they could be in the back end, like in a pharmacy and places like that. So that's how we divided them. We identified them. Having identified them, we did not send, or we could not send the registration link to all of them at the same time. So there was a random pick of about 60% because when we started the process, we did not know how well it would be received, whether there will be hesitation in registration or they will be just, everybody will swamp at the same time. So either way, to keep that safety profile, we started sending out only 60%, and depending on the response we got, we rolled out the rest 40%. But having said that, the most important factor is if you get X number of doses, you can book only half of them because you want to make sure that the people get the second dose also on the 21 days exactly after the first vaccine.
Right.
So that was the first question. The second question that you asked me was, what if I have 4 choices? Now, it's not going to happen like that in the first 2 months because genetic vaccines have rolled out first, both the Moderna and Pfizer. They said they can supply 100 million. So right behind them is the AstraZeneca and Johnson & Johnson are coming out, and they are expected to come out when general public can get it. So sometime during March, April, and then going forward, May, June, one by one, they are going to get their vaccines in the market. So unless Moderna or Pfizer can really ramp up to such an extent that they also are available at the same time, I do not see a clutter in the market. It's almost like I was listening to Dr. Fauci yesterday again. I'm sorry, like I keep quoting him, but he is the man, right? So he was also explaining that that kind of situation may not arise. In fact, this is an advantage that they are rolling out one by one. So most of the frontliners, first year, first phase population will be covered with the Moderna and the Pfizer. And then by the time the general population has a choice, which is anticipated in March or April, you will have 2 other choices available. And by that time, probably Moderna and Pfizer will start focusing on other countries or other places, and US population will have a choice of these 2.
Yeah.
Many a times it is not a matter of choice, but it is a matter of availability. Like large institutions like Massachusetts General, let us say, I'm just quoting it, or Women's Brigham Hospital. Now they have large storage capacity, cold storage capacity. So it is in their interest to get Pfizer because they can handle the Pfizer vaccines. They have the liquid nitrogen, they have the freezers. So like Massachusetts is getting like that. The state of Massachusetts got Pfizer because they have large capacity to store the cold vaccines.
It's good to hear that if you have vaccine, they are counting 100,000 suppose, so they are using only half of that because they need to give the second dose to the people. So one thing is very clear. If you got the Pfizer, you have to make sure you follow up and take the second dose. You got the Moderna, make sure you follow up and take the second dose. And they give you the card, which is a good system.
Right.
You have a guarantee to get the second dose. Right? So system is in place. When it comes to the choices, so even believe that we have all 4 here. So let's see choice. Which one I said? We are not at the place. We are in epidemic mode. More the disease spread, more difficult it is to control. I will say first come, first serve. The Pfizer comes to the market first. All the people on the front liner line up. Moderna comes second. The vice president got it. So when you think about that, as the vaccines are coming, make sure you take it because 2 things, and we talked earlier, you wanted to protect yourself and you wanted to protect your loved one. So here is no choice. Here is not that I'm just going to go and pick whatever I want.
Yeah.
Now let's assume what happened to AstraZeneca. AstraZeneca was the front runner. Even it's 2 doses, but they were front runner. And now they have a situation where they really have to generate the clinical data which they can justify.
Mm-hmm.
Where they did the clinical trial in Brazil with the half dose, full dose and full dose. And UK, they follow up with 900 patients, which is the half dose and full dose. And big difference in efficacy. So now in US, they have to prove again. So things can go wrong. So my point is to everyone, if you are waiting, don't wait. Things can go either way.
Yeah.
Now let's talk about the single dose versus the multiple dose. So J&J is doing 2 studies. One, they are doing the double dose too in UK, and they are doing single dose too. And they are optimistic that single dose is going to work. They're going to have some data coming in early January. If data comes as good as people thinking about it, then you do have option. But we have to wait till we cross that road. Because it can happen the same thing what happened to AstraZeneca. So I will say, everyone, if you get the opportunity to take the vaccination, take it. Don't wait.
Let me reach out to Dr. Shah now. Dr. Shah, with all due respect, what would be your suggestion to senior citizens?
So now I think we are all hearing from the TV and everywhere else that seniors, and particularly who are immunocompromised or having some vulnerable aspects of the disease, such as hypertension, diabetes, kidney problem, I think they are more prone to get probably some sort of severe reaction to the virus. On the other hand, when you look at the younger people, they have the immunity, natural immunity with the T cells, and they can fight it off. So when it comes to seniors, first and foremost, what we need for 6 months, lock yourself out. If it is possible, do not go out until you get your vaccine. With respect to vaccine, I think what Dr. Sharma and Dr. Sandeepa both said, that these vaccines are not approved without the word safety. They are all safe. We have not seen any single incident of the people dying. Otherwise, FDA will not approve it. So all the ethical companies, Pfizer, J&J, AstraZeneca, they are very careful about putting any drug on the market or the vaccine on the market, that if they have a single incident, and Dr. Sharma has mentioned about the hiccup AstraZeneca went through for very little small thing, but now they have to repeat the study. So to me, together with the pharmaceutical company, which are very ethical, and also the watchdog from FDA, I think we should be assuring to senior citizens that so far we have not seen any single incidents of people dying from vaccine. We got the reaction from the vaccine, which is typically the reaction that sometimes you get it from the flu vaccine. For example, muscle aches, pain, temperature, and sometimes allergic reactions. So people who are prone to sometimes allergic reaction, they should try to get their vaccine in the environment, for example, either hospital or the doctor office, that they can get the antidote should there any reaction from the vaccine at all. However, advice to the seniors, naturally be careful, keep the distance and everything else, but when you get a first chance to get the vaccine, and I think government is very mindful about giving the chance to the people who are 75 and above and 65 and above, particularly pre-existing condition, they will get the first preference. So my request and appeal to the seniors that whenever you get a chance, get your vaccine and don't think too much about it, because they are safe and it has been already administered to millions of people.
Yeah. Dr. Utpat?
हाँ, तो फर्स्ट ऑफ ऑल ये है कि हम सीनियर्स एज अ ग्रुप ऐसे उनको सेपरेट करके ज्यादा हाई रिस्क कैटेगरी बता नहीं रहे हैं, लेकिन मैटर ऑफ फैक्ट ये है कि जैसे ही आपका एज बढ़ता है तो आपकी प्री एग्जिस्टिंग कंडीशन कुछ ना कुछ ज्वाइन हो ही जाती है. सो एज अ ग्रुप व्हेन यू लुक एट द सीनियर्स एज अपोज टू a younger population between let us say 25 45 for 25 to 45 चलो ले लीजिए, तो उनमें कोमॉर्बिडिटीज कम होती है, इनमें कोमॉर्बिडिटीज ज्यादा होती है. इसीलिए हम लोग सीनियर्स की बात करते हैं. और हॉस्पिटल के एक्सपीरियंस से हम आपको बताते हैं, अगर मेरे पास एक 30 ईयर ओल्ड वाला बंदा हो और 70 ईयर ओल्ड बंदा हो तो मैं किसके बारे में ज्यादा फिक्र करूंगी, राइट? और किसकी आउटकम ज्यादा नॉट सो फेवरेबल होगी. So the person who's 70 year old who has a couple of comorbidities, that outcome I cannot predict and probably is less favorable. इसीलिए बोलते हैं कि इसीलिए इंसिस्ट करते हैं अभी कि सीनियर लोग पहले वैक्सीन ले लो आपका. और ये तो वी आर टॉकिंग अबाउट अभी जो उन्होंने बताया कि तो वी आर टॉकिंग अबाउट द सीनियर्स इन द कम्युनिटी जो अभी भी एक्टिव सीनियर्स है, इधर उधर जा रहे हैं. लेकिन आप सोचिए कि कई सीनियर्स है न्यू जर्सी में, लेटर से हम तो न्यू जर्सी की बात कर रहे हैं, तो सब एक्यूट रिहैब्स में है, नर्सिंग होम्स में है, आउट पेशेंट रिहैब्स को जाते हैं. तो आप सोचिए कि उनके कांटेक्ट में कितने लोग आते हैं, तो उनके केयर गिवर्स कितने होते हैं, हाउ मच केयर दे नीड एंड हाउ मच इन कांटेक्ट दे आर विद नर्सिंग असिस्टेंट हो, नर्सेस हो, फिजिकल थेरेपिस्ट हो, ये हो वो हो. और वो लोग बाहर भी कीमोथेरेपी के लिए भी जाते हैं, आउट पेशेंट थेरेपी के लिए काफी लोग जाते हैं सर्जरी के बाद में. तो ये इसके लिए बोलते हैं कि अगर आप एक सीनियर को अगर आप वैक्सीनेट कर दो तो आप इन सभी लोग ये जो उसके इर्द गिर्द होते हैं उनके, वो सभी प्रोटेक्ट हो जाते हैं. कि वाइस वर्सा भी वही है कि that person can infect the senior, but if the senior has an infection and is carrying the virus, that person is capable of infecting this many number of people because of the close proximity. तो इसीलिए बोलते हैं कि सीनियर्स को प्रेफरेबली पहले वैक्सीनेट कर दो, क्योंकि उनके केयर गिवर्स और वो खुद भी सभी लोग प्रोटेक्ट हो जाएंगे. और एलर्जी की बात करते हैं तो छोटी छोटी एलर्जीज जो होती है उनका वो तो एंटीबायोटिक के टाइम में भी होती है. सभी लोग बोलते हैं कि पेनिसिलिन की एलर्जी है, तो हम रिस्क वर्सेस बेनिफिट उनका वो देख लेते हैं. और अगर आप हमारे सामने अगर आपको हम एंटीबायोटिक दे रहे हैं तो यू आर बीइंग मॉनिटर्ड, इफ नॉट नाउ देन व्हेन, राइट? एंड इफ नॉट हियर देन वेयर एल्स. तो वैक्सीनेशन अगर आपकी एनाफाइलैक्टिक टाइप हो, बहुत सीवियर एलर्जिक रिएक्शन आपको होती होगी, जो जैसे कि बहुत लोग एपीपेन लेके घूमते हैं, तो वो लोग जब वैक्सीनेशन लेते हैं तो मॉनिटर्ड सेटिंग में लेना जरूरी है. बाकी जब आपकी माइनर रिएक्शंस होती है, कॉन्टैक्ट डर्मेटाइटिस है, एक्जिमा है, या फिर आपको एस्मा है थोड़ा सा, तो आपको पता है कि क्या होता है एलर्जिक रिएक्शन के टाइम में. सो थोड़ा सा मॉनिटरिंग, जहाँ एक छोटा सा मॉनिटर्ड सिस्टम है जैसे सीवीएस मिनट क्लिनिक है या फिर आपकी डॉक्टर की ऑफिस है, वहां अगर आप ले लेंगे तो फिर भी आप सेफ है, क्योंकि अब क्या करना है अगर एलर्जिक रिएक्शन हो जाती है तो वो उनको पता है कि क्या करना है. So that is why it's safe to take in those areas.
Now, allow me to take this video message from Dr. Krishan Kumar. He is he's one of the integral members of the New York City COVID-19 task force, and he's also on the he's an expert in EMS. Take a listen to his video message.
Good evening, everybody. My name is Dr. Kumar. I'm professor of pediatrics and emergency medicine. My area of expertise is emergency medicine and the ambulance. I would like to share some of my personal experiences with this coronavirus. I got sick with coronavirus in 2020, month of March and April. I suffered very badly with this coronavirus. I was bedridden for at least 1 week. Somehow that I got better. I developed antibodies. Now, luckily, we have vaccine for the coronavirus. It is such a wonderful moment in our lives. At least we can take vaccine. We can prevent from getting the disease, and also we can prevent to give this disease to somebody else. I'm 66. If I could take it, I just took my vaccine last week. If I could take it, I would suggest everybody on this earth, if you get the opportunity, please take it, take it, take it. Coronavirus is a deadly virus. COVID-19 is a very bad disease. We lost a couple of our own friends, doctors, working in the offices, working in the clinics and the hospital. They got sick and they did die. So please take it seriously. It does have some side effects. Side effects are nothing in comparison to the death. Most of the time, side effects are pain at the injection site or the fever or getting some body pain, this and that. That is nothing. The value, the benefit what you get after getting the vaccine, that's outweigh much more than your risk. So my humble request is, please take the COVID-19 vaccine. I'm especially thankful to Mr. Vikas Nagia for arranging this video conferencing. Thank you so much. Have a nice day and God bless you. Bye.
Actually, what Dr. Krishna said resonates.
Dr. Krishan Kumar, yeah.
Krishan Kumar, okay. It resonates so much with what I have seen in this area. Many of my colleagues got sick. Some of them mild, and some of them were so sick that they really lost their nerve. We are a group of infectious disease doctors, and we are like 4 pillars of a little table. And one of them got sick. It's been 3 months, and she still doesn't have the nerve. Somehow she lost the nerve, bolte hai na? So she still has some side after effects, and she's not able to do the entire day. So मैंने बहुत करीब से देखा है इन डॉक्टर्स को. और मेरा सबसे वर्स्ट केस सिनेरियो जो मैं बोलती हूँ कि I do not want to take care of someone who I know very closely. It is so difficult. It is so difficult. Emotionally, also it is so difficult. So I resonate with him. I'm so happy that he made out, and I'm sure he still feels the after effects to some extent. तो जो बाकी के ये जो हमारी कॉलीग्स है डॉक्टर्स, उनके बहुत उनके एंटीबॉडीज हो गए हैं, बिकॉज and being doctors and being in the field and working in the hospital, they have the ability to go and check for antibodies. But I know many people who will swear that they had it and they just do not have the ability to go and check for the antibodies. It does need a doctor's prescription. And most of the time, if there is no need, why do it? ये भी होता है. So they let it slide. But जिनके जो antibodies है, उनके भी मेरे को बहुत questions आए हैं last कुछ दिनों में, क्योंकि हमारे पास वैक्सीनेशंस अभी आ गए हैं, तो रजिस्टर करें ना करें, ले या ना ले. तो कई डॉक्टर्स है कि मंथली बेसिस पे उसको चेक करते हैं. मसला ये है कि जब एंटीबॉडीज आप चेक करते हैं तो सिर्फ क्वालिटेटिव एंटीबॉडीज के बारे में रिजल्ट मिलता है, क्वांटिटेटिव का नहीं मिलता है. तो आप पॉजिटिव हो या नेगेटिव हो, इतना ही देते हैं रिजल्ट. जो मैंने पूछा भी कि क्या हमारी लैब में कैपेसिटी है टाइटर देने की, इन 1 in 5 1 6 1 in 1 पॉइंट जो रेशियो होता है, जो जितना आपका हाई टाइटर है उतनी आपकी प्रोटेक्टिव इम्यूनिटी है. तो ये तो पता नहीं चलता है फर्स्ट रिजल्ट में. तो हमको पता लगा है कि है कैपेसिटी, लेकिन वो लेबोरियस होता है टास्क, तो वो सेकंड स्टेप नहीं करते हैं, सिर्फ आपको बोलते हैं कि पॉजिटिव है या नहीं है. और सभी एंटीबॉडीज ऐसे होते हैं कि ओवर अ पीरियड ऑफ टाइम वेन हो जाते हैं. वेन होना मतलब उनकी मात्रा कम 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 हो जाती है. जब हमको अभी ये पता नहीं है कि कितनी मात्रा तक आप प्रोटेक्टेड हो, कि जब वो घटने लगती है तो जब इतनी घट जाएगी तो क्या आप प्रोटेक्टेड हो उस वायरस से. ये है क्योंकि वायरस तो हमारे इर्द गिर्द है, हम तो उसको इनहेल करते ही रहेंगे. तो फिर वैक्सीनेशन क्या करता है आपके लिए? वैक्सीनेशन ये करता है कि आपकी बॉडी में इतने एंटीबॉडीज है, प्रोटेक्शन, इतना आपके पास आर्मामेंटोरियम है, इतनी वेपन्स है कि जब वो बाहर से आता है तो ऑलरेडी आपकी एंटीबॉडीज उसको न्यूट्रलाइज कर देती है. तो उसको बोलते हैं कि न्यूट्रलाइजिंग एंटीबॉडीज. तो आपके अंदर न्यूट्रलाइजिंग एंटीबॉडीज इधर नेचुरल इन्फेक्शन से होती है या फिर वैक्सीनेशन से होती है. लेकिन गारंटी ये है कि जब वैक्सीनेशन मिलता है तो न्यूट्रलाइजिंग एंटीबॉडी की मात्रा बहुत ज्यादा होती है, तो वो ऑलरेडी प्रोटेक्टिव एंटीबॉडी भी बन जाती है, नॉट जस्ट न्यूट्रलाइजिंग. तो वो जो टाइटर है वो रूटीनली अवेलेबल नहीं है. इसीलिए हम लोग बोलते हैं कि अभी हमारे हॉस्पिटल में तो हमने डिसाइड कर लिया है, और सिर्फ मैंने नहीं डिसाइड किया, जैसे कॉर्पोरेट से ही हमको ये इंस्ट्रक्शन आ गया है. सभी इंटेलेक्चुअल और ज्यादा हमसे ज्यादा जो स्मार्ट बंदे, उन्होंने सबने मिलकर डिसाइड कर लिया कि 90 डेज के पहले आपका टेस्ट अगर पॉजिटिव हो, उसके अगर आपका लास्ट पॉजिटिव टेस्ट 90 डेज हो गया है, तो आपको वैक्सीनेशन लेना आपके बेनिफिट में है, हित में है, क्योंकि तब तक आपकी एंटीबॉडी शायद कम हो गई होगी. ये एक पॉइंट हो गया. पॉइंट दूसरा हो गया कि आपको अगर माइल्ड इलनेस हुआ हो तो ये नहीं बता सकते कि आपकी एंटीबॉडी रिस्पांस बहुत रोबस्ट हो गई हो. जैसे बहुत सीवियर इलनेस हो गया है, जैसे डॉक्टर कृष्णा का था, तो मैं अगर प्रिडिक्ट कर सकती हूँ तो इनका एंटीबॉडी रिस्पांस भी बहुत बड़ा होगा. ज्यादा इल होने से ज्यादा एंटीबॉडी रिस्पांस भी ज्यादा होता है. माइल्ड इलनेस अगर आपको हुआ और चले गया है तो शायद आपकी एंटीबॉडीज भी इतने ही हो गए उस टाइम में, तो और 90 डेज 120 डेज के बाद में शायद आपकी बॉडी में है भी नहीं. अगर है तो सिर्फ लेबोरेटरी वाइज वो डिटेक्ट होते होंगे. क्या वो प्रोटेक्टिव है आपके लिए, ये नहीं बता सकते, और शायद नहीं भी है. इसीलिए 90 to 120 डेज पहले अगर आपका टेस्ट पॉजिटिव है और इस बीच आप ठीक ठाक हो, so that means that yes, you have a little bit of probably antibodies in your body, but not to the protective level. So you should take the vaccination, and that will not interfere with the antibodies that you already have, because it follows a different mechanism. And then you will get protective antibodies.
Dr. Sharma, would you like to add, specifically as I mentioned, a lot of people are thinking that it's a cure and it's not, they're not understanding that it's related to prevention.
तो देखिए, सबसे पहले 3 पॉइंट जो डॉक्टर संदीप जी ने बताया बिल्कुल करेक्ट है. सबसे पहले, दिस इज नॉट ए क्यूर, दिस इज अ प्रिवेंशन. ऑल वैक्सीन्स आर ऑलवेज प्रिवेंशन. ठीक है, ये रूल नंबर 1. यदि किसी को कंफ्यूजन है तो देखो, रूल अपने स्मॉल पॉक्स वैक्सीन है, जितने भी है, मीजल्स की है, हेपेटाइटिस भी है, दीज आर नॉट क्योर, दीज आर ऑल प्रिवेंटिव. ठीक है. दूसरा नंबर जो उन्होंने बताया बिल्कुल सही है कि जो जिसको एक्सपोजर हो गया है उनके सर्कुलेशन में एंटीबॉडी है, लेकिन वो एंटीबॉडी कितनी है, कितनी मात्रा में है, क्या वो एंटीबॉडी सचमुच में यदि इन्फेक्शन हो तो प्रोटेक्ट कर सकती है या नहीं ह्यूमन बॉडी को? बहुत बड़ा सवाल है, और ये जो है बिल्कुल क्वाइट अननोन. तो जैसे उन्होंने कहा है कि 90 डेज इज ए सेफ गार्ड, और यदि आप देखते हैं ये जो वैक्सीन है तो क्यों सब 2 शॉट लगा रहे हैं? 1 महीने के बाद में क्यों लगा रहे हैं सब लोग? द रीज़न इज़ वेरी सिंपल कि इम्यूनोजेनिक जो रिस्पॉन्स है उसको मेंटेन करना है। द टाइटर उसको मेंटेन करना है ताकि कल उठ के यदि इन्फेक्शन होता है तो बॉडी कैन प्रिवेंट इट, बॉडी कैन डिफेंड इट। So definitely it's a good question. Guys, this is not a cure. This is a preventive measures. And जब epidemic होता है, more than 1.7 million people are dead in the world. एक मिनट सोच लो आप, more than 1.7 a number is going. Don't think that this is cure, I will get it when I get it. No, this is the prevention. Don't wait till I will wait till I get the AstraZeneca vaccine. No, take it. We are in such a place that we don't have to think again. If you have some preventive option in front of you, please take it.
I was reading yesterday a very nice article in New Journal England of Medicine, and it clearly mentioned that right now, based on the data they have, 90 days is a good period. For example, we all know this vaccine is in short supply. So what about those seniors or first line of the healthcare worker who needs them because they are daily coming across the patient who has the COVID virus? Second thing is people who are vulnerable and senior citizens. So if you have already got the infection, at least wait for 90 days until March, April. Then you get a turn, and if you get a vaccine, you should go for it. Meanwhile, we will have another 3 months data because right now there is not enough data available that how long this wearing effect lasts. Does the vaccine that you are getting, the antibody produced from that, it is lasting how long? The idea is probably booster, as Dr. Sharma has mentioned, that you wanted to bring the efficacy at 95% level. And that's what both the company almost did it. So probably, hopefully, the data will speak itself. Right now, we do not have the data. However, at least it is a good idea to wait for 90 days and give other people a chance.
एक छोटा सा ब्रेक लेते हैं. On the other side of the break, we'll have some more interesting questions related to our topic today. We'll be right back after these messages.
Bombay Kitchen offers a full line of non-vegetarian entrees and appetizers made fresh daily with over 25 mouth-watering varieties. All natural ingredients, halal certified. Also proud to introduce tandoori lamb chops and chicken halim.
Some people say dress your age. That's ridiculous. I dress how I feel. Yesterday, I felt bold with boundless energy. This morning, I woke up calm and unbreakable. Tomorrow, who knows? Age is just an illusion. How you show up for the world, that's what's real. What's your idea? I put it out there with the GoDaddy website. Make the world you want.
Akshaya Patra, the unlimited bowl of abundance and sustenance. The organization is the world's largest midday meal program, feeding 1.8 million children every day.
Giving that comes from a place of abundance is spiritual. Children have infinite potential.
Hi, this is Jeetal Pandya. Vastu Feng Shui services are valuable for your home and business. Pallavi Ji helps you make the right decision. So, call Pallavi Chilavada today. एक राह और सही दिशा जो जिंदगी बदल दे.
Welcome to Serenity Reserve, our premier boutique 55 plus active adult community. Only 3 minutes from Orlando and 15 minutes from Orlando International Airport. Where a healthy lifestyle is key. Our state-of-the-art amenities allow you to enhance your mind, body, and spirit. We have 4 beautiful models for you to choose from. Visit us online at serenityreserve.com or call today.
We're
going to need a lot of wine to get through this year. First Leaf's got your back with great wines delivered right to your door. Get 6 bottles of outstanding wine, normally $149.95, now just $39.95 with free shipping. Rate your wines and we'll find new ones personalized for you. With over 1,000 awards, we guarantee you'll love these wines. Get 6 bottles of great wine for only $39.95. Visit firstleaf.com/TV today.
कार्यक्रम के आखिरी पहर में इससे पहले कि बातचीत को आगे बढ़ाएं, कुछ वैक्सीन हीरोज के मैसेजेस, वो कैसा महसूस कर रहे हैं वैक्सीन लेने के बाद. लेट्स टेक अ लुक एट देम. These messages are again from across the country. Take a listen.
Hi everyone, I am Dr. Nishat Chalam. I'm both certified in internal medicine and also holistic and integrative medicine. I practice functional medicine, which is getting to the root cause and rebuilding people's health. As far as vaccines go, I totally believe in them. When I rounded as a medical student, it was in wards that had tetanus, rabies, and polio, all of which are non-existent due to vaccines. Having said that, I also would like to bring your attention to the existence of VAERS. VAERS is the Vaccine Adverse Effects Reporting System. And this came into existence because some people do react to vaccines. And who are these folks? These are folks with altered immune functions like severe allergies, hypersensitivities, autoimmune conditions like Hashimoto's, lupus, rheumatoid arthritis. So what we don't know about this particular vaccine is the long-term side effects. For those patients, I would say you just wait 6 months to learn a little more about the long-term effects. The rest of us, I think it's a very safe vaccine to get.
Hello, this is Dr. Vamsi Nukala, practice internal medicine with Anderson Medical Group in Maryville, Illinois. During this pandemic, all the frontline workers have been putting their own lives at risk to serve and help take care of all the people. The best thing you could do at this point of the pandemic is be educated about the new vaccines that have been developed, one by Pfizer and the other one by Moderna. If you have any questions about these vaccines and how they work, and to become educated, you should discuss all of the information with your physician. And I highly recommend getting the vaccine once you have made the informed decision, as I have last Friday. Help stop the pandemic. Take care.
I'm Dr. Avinash Gupta, President of Mokapi and a cardiologist. Being a frontline health worker, I was offered the vaccine, and at the first opportunity, I signed up and showed up today at my hospital where I was given the first shot. I was observed for 15 minutes and released. I told myself that I am not the first one to get the vaccine. The vaccine was already tried in 44,000 people in the Pfizer trial. And out of 44,000, 22,000 did get the vaccine and 22,000 got the placebo. Out of 22,000 getting the vaccine, only 8 people got COVID, whereas 22,000 people getting the placebo, 161 people got the COVID disease. That's where the 95% efficacy comes from. Not only that, they were observed for 2 months. Usually, the side effects happen in first 6 weeks. So FDA did have the safety data for 2 months. And usually there were soreness at the injection site and some fatigue. And they went away in 24 to 48 hours. So I went to my office and saw patients all day today. And when I came home in the evening, when I was taking a shower, when I touched here, then I suddenly realized that, I have a Band-Aid there. And when people started to ask me, do you have any side effects? Then I thought, okay, I do have some soreness. So I would recommend everybody to get the vaccine when it is made available to you. Save lives and save yourself, save your family. Thank you.
So, word of encouragement from all the physicians, suggesting the community to take the vaccination when it's available to them. Dr. Utpat, we're just running out of time, but I just want to quickly get some brief answer from you. Individuals, especially ladies who are pregnant or who are breastfeeding, should they be taking the vaccination?
So, yes, today I heard something about that. And pregnancy is considered as somewhat of an immunosuppressed state, right? And also, because the studies were not done in pregnant women, and let me put it this way, pregnant women were not included in the studies as such. So, there is some reluctance to recommend it. But when they deliver, then they are considered as good candidates to get the vaccine, because if they are making antibodies, those antibodies can be shed in the breast milk and will be beneficial even to the babies. So pregnant ladies, maybe not, discuss it with your GYN, and probably just masking, social distancing, and waiting for delivery is the better option. But breastfeeding women who have delivered recently, even if they are not breastfeeding, right candidates for the vaccine.
Well, doctors, thank you so very much for your time, sharing your expertise, knowledge, and say certainly with confidence that hope is on its way. Thank you so very much for joining us in Focus Live Season 3.